Hi, I'm Joan Snow and my CEO says I should talk to you because your hospital has had zero healthcare associated infections for 3 years.
Yes. As the infection preventionist, I can say that's true.
Wow. That's amazing. I mean, I have my organization strive towards zero infections. And we have had some runs where we had a month here or there where we have had none, but zero for 3 years? That's incredible.
Yes. We did it. I have zero infections for 3 years.
How? I mean, don't you ever have bacterial translocation where the patient has no infection but the pathogen escapes the GI tract and appears in a blood culture?
We have those cases, but my ID doctor throws those out.
Your ID doctor? What is he doing surveillance for?
He always does surveillance after I find the cases that meet the definition.
Has he done any online training on how to use the definitions or done any SU trainings on the NHSN definition or gone to a HAI training?
No, he is an ID doctor.
So, despite the fact that you have cases that meet the NHSN collapse definition, you don't count them because your ID physician, who has no training on epidemiologic definitions or NHSN training, doesn't think they are NHSN cases?
Yes. He is an ID doctor.
How does he say they don't meet the NHSN collapse definition?
He is an ID doctor.
You already said they met the definition. Why even have him look at them?
He is an ID doctor.
We established that. Have you been to training on the NHSN definition?
Yes. I have done many classes and do the HAIs training on the definitions.
So, you are having someone who is incompetent at using the definition override your judgment as a trained epidemiologist.
He is an ID doctor.
Yes. And if I had a central line infection, I would want him to give advice on how to manage that infection. Why does he even want to look at the collapse cases?
He is very interested in collapse. As chair of the infection control committee, he gets a bonus for lowering the hospital's infections.
Don't you see that as a conflict of interest? Why would you allow the surveillance to potentially be compromised like that?
He is an ID doctor.
Let's talk about CADI. No CADI.
We have zero HAIs. My ID doctor reviews them.
Is your ID doctor's name Dr. No? Let's talk about SSISS. No small bowel infections? No colon surgery infections?
I have had no HAIs for 3 years.
How do you do surveillance for SSISS?
I look at the microbiology results, and if there are none, they are cleared.
What about radiology results?
I look at the microbiology results, and if there are none, they are cleared.
Why would a surgeon culture a gut leak? They use the x-rays to find abscesses and then treat. How about MD notes? Do you read them on the cases?
Doctors at my hospital write a lot.
Yes. How do you assure yourself they aren't diagnosing a surgical site infection in their notes or describing a wound infection if you don't read the notes?
Doctors at my hospital write a lot. Do
you do a search for antibiotic therapy post-surgery? Or returns to the OR?
I have had no HISS for 3 years.
We take that as a no. So you never had a failed anastomosis that resulted in an infection?
We have those cases, but my ID doctor throws those out.
Doesn't he know that the definition does not exclude them from being cases?
Yes, but he disagrees with the definition.
I can disagree with gravity, but it doesn't mean that it no longer applies to me.
He is an ID doctor. I have had no HAIs for 3 years.
Liar. Ooh, I feel an HI coming on.
I also have 100% hand hygiene compliance. Do you want to know how?